Welcome to Module 6A. This content has a copyright by Teaching Adults, Inc. and may not be copied or reproduced. All rights reserved. CNA Lesson Plan, Microorganisms. Module, Infection Control and Safety. Lesson Title, Understanding Microorganisms. Time allotment, 60 minutes. Target audience, Certified Nursing Assistant, CNA, students. Learning objectives. Upon completion of this lesson, students will be able to define microorganisms and identify common types found in healthcare settings. Explain the importance of understanding microorganisms in preventing the spread of infection. Describe the conditions necessary for microorganisms to grow and thrive. Identify common modes of microorganism transmission. List basic infection control practices related to microorganisms. Good morning, afternoon, everyone. Today, we're going to dive into a topic that's incredibly important for your role as a CNA, microorganisms. You might know them by a more common name, germs. But we're going to learn what they really are, why they matter, and how we, as healthcare professionals, can manage them. Today, we'll be using the scientific term, microorganisms. These are the tiny living things that often cause those germy feelings. By the end of this lesson, you'll be able to define microorganisms and identify common types. Explain why understanding them is crucial for preventing infection. Describe what these tiny critters need to grow. Identify how they spread. And, most importantly, list basic infection control practices you'll use every single day to fight them. 2. Defining microorganisms and common types. So, what exactly are microorganisms? Simply put, they are tiny living things that are too small to be seen with the naked eye. You need a microscope to see them individually. Now, let's talk about the main types you'll encounter in healthcare. Bacteria. These are single-celled organisms. Some are good for us, like in our gut, but many cause infections. Think of things like strep throat, pneumonia, or urinary tract infections, UTIs. Many bacterial infections can be treated with antibiotics. Viruses. Even smaller than bacteria. Viruses are tricky. They need to get inside a living cell, like one of your cells, to reproduce. Common cold, flu, chickenpox, COVID-19 are all caused by viruses. And here's a key point. Antibiotics do not work against viruses. Fungi. These are plant-like organisms. They often cause skin infections, like athlete's foot or ringworm, and sometimes yeast infections. They like warm, moist places. Parasites. These are organisms that live on or in another living thing, a host, and get their food from that host. Examples include lice and scabies. Quick question. Where do you think these tiny microorganisms live? They are truly everywhere, and that's why we need to be vigilant in a healthcare setting. Conditions for growth and modes of transmission. 1. What do microorganisms need to grow? Just like you and I need certain things to survive and grow, microorganisms do too. They're constantly looking for ideal conditions to multiply. Think of it like their dream home. Warmth. Our bodies are the perfect temperature for many germs to thrive. Moisture. Bodily fluids like blood, urine, sweat, and even just moisture on skin provide what they need. Food source. They feed on organic matter, like dead skin cells, blood, or other bodily secretions. Darkness. Many prefer dark environments over brightly lit ones. Instructor. When these conditions are met, microorganisms can multiply rapidly, increasing the risk of infection. How do they spread? Modes of transmission. Knowing where they live and what they need to grow is step 1. Step 2 is understanding how they move from one place to another, especially from one person to another. This is called transmission. Direct contact. This is exactly what it sounds like, direct physical contact with an infected person or their body fluids. For example, shaking hands with someone who has the flu, or touching a patient's wound without gloves. Indirect contact. This happens when you touch an object or surface that has been contaminated by an infected person. Think of touching a doorknob, a bed rail, or a call light after an infected patient has touched it, and then touching your own face. Droplet transmission. When an infected person coughs, sneezes, or even talks, they can release tiny droplets. These droplets are relatively heavy, so they only travel short distances, usually about 3 to 6 feet, before falling. If these land on your eyes, nose, or mouth, you could get infected. Airborne transmission. This is different from droplets. With airborne transmission, the particles containing the microorganisms are much, much smaller and lighter. They can stay suspended in the air for longer periods and travel further. Diseases like tuberculosis, TB, and measles spread this way. Understanding these modes of transmission is crucial because it tells us how we need to protect ourselves and our patients. The CNA's role in infection control. 1. Why is this important for CNAs? Instructor. Why do you, as CNAs, need to be experts on this? Because you are on the front lines of patient care. You spend the most time with patients, assisting them with daily activities, and coming into contact with their environment and body fluids. This puts you in a unique position to either break the chain of infection or, accidentally, contribute to its spread. Think about the consequences of infection: patient suffering, longer hospital stays, increased healthcare costs, and even death. Your role in preventing this is huge. Basic infection control practices. So, what can we do? Let's focus on the most important actions you'll take every day. A. Hand hygiene, the most important practice. This cannot be stressed enough. Hand hygiene is the single most important way to prevent the spread of microorganisms and infection. Let's demonstrate proper hand washing first. If sink available, wet hands, apply soap, lather for at least 20 seconds, sing "Happy Birthday" twice, scrub all surfaces, rinse thoroughly, dry with paper towel, use towel to turn off faucet. If no sink, use alcohol-based hand sanitizer. Apply to palm, rub hands together, cover all surfaces until dry. When should you wash your hands or use hand sanitizer? Before and after touching a patient. Before and after performing a clean, aseptic procedure. After exposure to body fluids. After touching a patient's surroundings. After removing gloves. Before and after eating. After using the restroom. Personal protective equipment, PPE. PPE creates barriers between you and microorganisms. It includes gloves, gowns, masks, and eye protection. For now, let's focus on gloves. Gloves are your first line of defense when you anticipate contact with blood, body fluids, secretions, excretions, or contaminated items. Environmental cleaning. While you might not be doing deep cleaning, CNAs play a role in maintaining a clean environment. This means promptly cleaning up spills of body fluids, ensuring soiled linens are placed in proper receptacles, and reporting dirty areas to the nurse. Cleaning and disinfecting surfaces helps remove microorganisms. Review key concepts. Okay, let's quickly recap what we've learned today. What are microorganisms? Tiny living things not visible to the naked eye. Can you name a type of microorganism? Bacteria, viruses, fungi, parasites. What's one thing microorganisms need to grow? Warmth, moisture, food, darkness. How can microorganisms spread? Direct contact, indirect contact, droplet, airborne. And what's the single most important thing you can do as a CNA to prevent their spread? Hand hygiene. Fantastic work today, everyone. Understanding microorganisms is fundamental to keeping yourselves, your patients, and your colleagues safe. You are now better equipped to be infection control champions in your future roles as CNAs.